Thanks, Justine. Thanks, Ryan, for having me, and thanks especially to AIM and to Sam for putting this on. I think this is a tremendous resource for patients and for their caregivers, and an opportunity for me to hopefully tell you a little bit about a different way that I think about treating cancer. So I'm a melanoma medical oncologist at Sloan Kettering. I trained here at MGH as well with Dr. Sullivan. Really my main focus is on how we use exercise to make our other therapies work better. So this is actually not a new concept. So this is from a dissertation written in 1983. This is actually the first study that was ever done on exercise in cancer. And this put patients with stage 2 breast cancer on a bike and said, what happens? Do you feel better? Do you stay well? And do you tolerate your therapy better? And the answer at that time was patients feel better. And that was about all they could conclude from that trial. It's a pretty good outcome for most of us, right? Feeling better is actually one of our main goals of what we do. And really this entire field launched from this PhD dissertation in 1983. So patients were able to safely complete the training program, which was a very important thing to show at that time while patients were on chemotherapy. And the trained patients were able to work harder and longer, right? And they actually improved their fitness while on chemotherapy as opposed to lost fitness, which most of us do. Since this time, right, this field has completely taken off. So we call this exercise oncology. And this is a slide that I stole from the American College of Sports Medicine, who had a roundtable. This is what's labeled as the second roundtable up here, this year to come up with new recommendations for exercise in cancer. But all I'm showing you here is these are publications in this field, right? In 1990, there were like 2, right? And now we are really up into the 200 plus per year of all of these studies looking at how we can bring exercise to cancer patients safely and effectively. So what do we know? So this came from actually the first roundtable, which was done in 2010. And this was a group of experts sitting around, literally a round table saying, what do we know about exercise in cancer from all of those studies that have been published? Because there's a lot of garbage, right? And then there's a lot of good science. And let's help everybody weed through that. So this expert panel was published in 2010. And the first and most important conclusion was that exercise is safe during and after treatment. And at this time, there was a lot of doubt about that. And I still hear a lot of doubt about that. Less maybe from our melanoma patients that are on maybe targeted therapy or on immunotherapy and doing okay. Much more from our patients on chemotherapy or on immunotherapy who are not feeling as well. And they say, are you sure this is okay? And the answer is, it absolutely is, with appropriate supervision and at the right intensity. We know that exercise can improve aerobic fitness, which can be helpful. But more importantly, from my perspective, there are very conclusive data that exercise improves quality of life and fatigue in cancer patients. The other thing that is somewhat still relevant to our melanoma population, though this was studied in breast cancer, is that resistance exercise using the arms can actually help improve lymphedema. And if nothing else, is safe for patients who have had a lymph node dissection. And that was studied in breast cancer because many more of our breast cancer patients undergo a lymph node dissection. But as we all know, this is still happening in melanoma for many of our patients. And so many of our patients are counseled, don't use your arm, right? Don't do anything with your arm. The risk of swelling is high, right? If you just don't move it, it will be okay. Right? And the answer is exactly the opposite. In fact, probably the best thing you should do is, again, exercise with appropriate supervision. So these are sort of the quality of life metrics, which I think are important, but it raised the really important question of whether exercise actually affects outcomes in cancer. Right? And so this is sort of a summary of the data that we have so far. And you can see, so a bunch of cancer sites here on the left, okay? And then if you exercise before you were diagnosed, or after you were diagnosed. And this is sort of a consensus statement from what most of the data say. So in breast cancer, what we know is that basically exercising before or after is really good for both cancer-specific and all-cause mortality. Right? Similar in colorectal cancer. Prostate, still pretty good data. In some of these other cancers, lung, kidney, the data are lacking, but starting to come. So what about melanoma? Well, the answer is we have no idea. Okay. So melanoma, as all of you know, is a rare disease, and this really hasn't been studied. And that's where I come in. So this is what I do most days, all day, every day. So the first question people ask often in this field is about the risk of developing a cancer. For many of us here, the cat's out of the bag, right? We already had our melanoma diagnosis. But it is a really important question. Does exercise actually help prevent the development of a cancer, and in our context, specifically melanoma? And so this is a somewhat complicated graph to read, but all I want you to do is look sort of down here at this middle line. So anything to the left of this line, right, exercise has shown that it helps reduce the risk of that cancer. Anything to the right of that line, there's association with increased risk of cancer, right? So things like lung cancer, liver cancer, right, breast cancer, colon cancer, all of these are sort of associated with this increased risk. Yikes, what about melanoma? Right? So all of us saw this and started panicking and say, well, we study exercise in cancer and I study exercise in melanoma, and this doesn't look great. So we went back to the data and said, why might there be an increased risk of exercise or increased risk of melanoma in patients who exercise? And it came back to one very simple answer, right? Most people exercise outside in the sun and either don't wear sunscreen or sweat off their sunscreen and don't put it back on, okay? So these trials actually never controlled for that. Just not the smartest way to design this trial, but if we went back and did it again, we're pretty sure that that effect would go away if we actually controlled for the time that people exercise outside versus inside, or wearing sun protection versus not wearing sun protection. So sunscreen is good. You're going to hear that all day today, right? But I really do think that, you know, there are some people out there saying, you know, exercise is bad for melanoma, and this is out there on the internet based on this trial, right? And the answer is no one looked at whether or not people were actually controlling for sun exposure, which we know is the biggest risk factor for melanoma. So I hope that at least alleviates some of that fear for those of you who have heard this myth. I don't think this is true, and I'm going to show you some more data of why that's true. So why might exercise actually affect a tumor? And there are any multitude of reasons. I tend to think of this in mice because I can control a lot of things in mice that are much harder to control in people, right? Things like diet and sleep and stress and other things that are much harder for me to control when I'm talking to a patient. But if I really want to study exercise, right, and solely what the exercise itself does, I can do that in mice pretty easily. So what does exercise do? So it affects the muscle. That's pretty obvious. But exercise also affects the bone marrow and the fat tissue and other organs like your liver. And that has a lot of sort of downstream implications for body systems like your metabolism, right? Like your immune system, right? Like your steroids and your sex hormones, all of these things that we know are actually really important for cancer growth and tumor growth. And in the tumor itself, we know that exercise can actually affect blood flow to the tumor and tumor cell death and some of these other pathways that are really important targets for us as doctors and thinking about how to treat our cancers. So the first study actually in mice came out a couple years ago. They put mice on a running wheel and either gave a mouse a wheel or a no wheel. Pretty simple experiment. Mice like to run. They gave them melanoma and they said, what happened to their tumors? So in a control group, right, that did not have access to the wheel, this is the size of the tumors. You can see that they're a lot bigger than in the exercising group, right, which was pretty reassuring to most of us. Now, wheel running is an interesting model, right? Because wheel running isn't really exercise, if you think about it, right? So a mouse jumps on a wheel, it runs. When it gets tired, it jumps off a wheel, right? So for us, that's more like physical activity, right? That's us walking around, parking in the back of the parking lot, right? And walking to the store, but it's not really exercise. It's not deliberately training or getting your heart rate up. And so my question was, well, okay, does that actually translate to training someone? Or do you really just need to do 10,000 steps a day or some other equivalent? So this is what I work on. So basically, I do the same thing. I give mice melanoma, and then I put them on a treadmill. And I have complete control of how fast they run on that treadmill and how steep the treadmill is and how long they run on that treadmill. And then I can measure things like how fast their tumor grows and all of the different immune cells in the tumor and in the blood, and hopefully learn to manipulate that to help our other therapies work better. So what I do, as I said, I give a mouse melanoma. I teach it first how to use the treadmill, right? Then I give it melanoma, and then it either runs or it's sedentary. Pretty simple, right? And what you can see here, oh, sorry, the label doesn't show up, but this light blue group is the sedentary group, meaning that the tumors grow much faster than they do in the group that runs, right? Running helps control the tumor growth in and of itself without doing anything else. So then I ask the question, well, okay, if I want to know why that works, what if I take the immune system out of that, right? We know that immunotherapy is probably one of our best tools to control melanoma. So what if I manipulate the immune system in the mouse? Right? So I take out all of the B and T lymphocytes, which are just some of the key immune cells that we use, and I see that this effect goes away. Meaning that in some way, this exercise is working on the immune system, right? Or working through the immune system to help control the tumor growth. So that gives us a lot of ideas then about how we could use exercise if we knew how it worked, right? To combine it with our other therapies, like immune therapy, but also we know that immune therapy plus radiation, or immune therapy plus chemotherapy, or immune therapy plus radiation all have important sort of synergistic effects. And so why not exercise as an immune therapy or exercise plus an immune therapy? Right? Now we have a lot of questions to answer to do this, right? So the first is, when we think about prescribing exercise, if I'm gonna prescribe you a drug, right? I need to know how much. I need to know, do you need to take it once a day? Do you need to take it twice a day? Do you need to do it every day? Right? Do I skip days? Right? So I need a prescription. So how much? How often do you need to exercise? At what intensity do you need to exercise? Is walking okay? Or do I need to get your heart rate up more than that? Right? What type of exercise? Does resistance exercise work differently than aerobic exercise? I don't know. Right? The timing of that. If there is a way in which we can use use exercise to help ramp up the immune system, does it come up at a certain time? And maybe that's when I should give you immune therapy or give radiation therapy. These are the types of things that we're trying to understand to how to combine exercise. So how do we learn more about this? So there is an entire group that is really focused on this concept. They are out of the American College of Sports Medicine. Their website is pretty easy to remember. It's called Exercise is Medicine. Okay. And they have an entire group devoted to exercise as a cancer medicine. Right? They have a registry that is being built right now around the country and around the world of programs for patients that have cancer or have survived cancer. So I didn't go into this today, but what we know is that for cancer survivors, right, there is also a benefit to exercise. And so this registry is really trying to be a resource to all of you, as well as people all over the world, to help you identify people close to you who actually have experience in this. So if you remember back to the beginning of this talk, I said this is safe when appropriately supervised, right? And this is exactly what this is aimed at. This is trying to help link you up with people who actually have experience doing this and understand the science behind this, so we understand how much, when, all of those things. So for those of you who live here in Boston, I went through the registry for you, and there is a program here right across town that actually works with all patients who have cancer and are cancer survivors. right? Open to any type of cancer. I know that there are actually some other patients with melanoma that are in this group because I've sent them there. So this is an excellent resource. This is one of many. For those of you who are streaming online who maybe aren't here in Boston, go to that Exercise is Medicine website. You will find a local resource near you. If you can't find a local resource near you, please reach out to me because I know where many of them are that aren't yet fully linked into the registry. With that, I will say thank you. I wanted to leave enough time for questions since unfortunately I do need to head back to New York to give another presentation there this afternoon. This is our melanoma medical team at Sloan Kettering, all of whom have been exceptionally supportive of trying to bring these additional therapies to our patients. So with that, I'll take any questions that you have.
Thank you so much. That was incredible. I think we have a bunch of questions and I'm going to read them out. So one question is, you know, how would you sort of apply this to other non-cutaneous melanomas, mucosal melanomas, ocular melanomas? Do you think the data is still the same? I'm sure you get that question a lot.
I do get that question a lot. The answer is, I would love to tell you, but I don't know yet. I think that in large part the data probably are, or at least some of the biology is the same or very similar. However, what we know is that particularly if we think about ocular melanomas, they are less immune responsive. They have less immune cells in them. And so how does exercise affect that? I'm not sure. Unfortunately, our mouse models to study this aren't as great yet. And so I'm actually working on the other end of this just to start bringing this to patients and try to understand it, you know, sort of in the one-on-one clinical trial setting, because I don't know that that's a question I can answer in a mouse. From a mucosal melanoma standpoint, I don't have great mouse data, but we do at least have some correlative human data that say it's probably helpful in the same general vein, but the evidence certainly isn't as strong.
Thank you. Another question, I've gotten this question a lot, I'm sure you have. After a procedure such as a dissection, a liver embolization, any sort of procedure that our patients go through, is it safe to exercise afterwards? And what about like massage therapy, yoga therapy? I mean, I know we're gonna have a talk on complementary medicine today, but what do you recommend for your patients?
Yeah. So after any procedure, exercise and massage and all these things may eventually be good, right? But the most important thing you can do is talk to whoever did your procedure, right? So obviously, you know, a little excision from the skin may be a smaller thing, may only take a couple days, and then your doctor may feel completely comfortable with you exercising in whatever way that is, right? A big open procedure that has an open wound obviously may take longer to heal. Also, we worry a lot about particularly procedures that involve the gut or the liver, really needing to heal before we increase blood flow to that area or change blood flow to that area. So a lot of this is sort of a one-on-one conversation with whoever did that procedure, kind of dependent on how big the procedure was, how well you were before the procedure, right? So someone who's been through a lot of treatment or hasn't been doing as well will take longer to recover from a procedure. But eventually we want to get all of our patients back to at least some form of physical activity.
Great. Couple more questions. Actually, Allison and I had dinner last night and we were talking about the various kinds of exercise that we each do. For anything from jujitsu and CrossFit to bar and Pilates. What do you recommend for your, like while we're gathering this data on exercise, is there a kind of exercise that you recommend for your patients? Yoga, running, what sort of exercise do you recommend?
So my best answer to you is anything that you will do and stick to and enjoy. Okay. So the recommendations for the guidelines essentially for what we recommend to patients who have cancer actually mimic exactly what the guidelines are for healthy US Americans, which is 150 minutes of exercise a week, which is 30 minutes a day, 5 days a week, of a low to moderate intensity exercise, like walking, or 75 minutes a week, which is much less, right, about half, of a more intensive exercise, right, whatever that looks like for you. That could be swimming, that could be, in my case, CrossFit, or jujitsu, in Justine's case, bar, right? But those types of things, they all count, right? And that's somewhere between 15 and 30 minutes a day, 5 days a week. We think consistency really matters here. So doing 150 minutes on a Monday and then waiting till the next Monday is probably not nearly as good as doing 15 minutes a day, 5 days a week. And really it's because this is just, if we think of it, it's not a drug, but it's sort of like a drug. Your body needs to keep seeing it over and over and over again, right?
A lot of questions I get are regarding prednisone, because a lot of our patients either require high dose prednisone for a long period of time, or they remain on low dose prednisone, and it does affect their heart rate, how much of a response they can mount when they're exercising. I have one patient who might be listening who is like an extreme athlete and never really feels like he can get his maximum time for his mile, which is faster than anything I could ever run. Yeah. So like, how does that play into effect, and what can you advise for those patients?
Yeah, that's a really great question. So steroids certainly affect a lot of things, including your exercise tolerance, including your bone strength and your muscle strength, right? So heart rate is definitely affected by steroids. We know that. Both your baseline heart rate goes up often, at least in the sort of early exposure to steroids. Your body may adjust to that over time. But also your ability to really tolerate a maximal heart rate can go down with high dose steroids. And so sometimes we have to adjust, your mile time may go down. That's okay for right now. That does not necessarily mean you shouldn't run that mile, right? That means we should adjust our expectation of what that mile will be while we're on high dose steroids, right? Getting back towards lower dose steroids, or what we tend to call physiologic dosing, that sort of 5 to 10 milligrams of prednisone that many of our patients stay on for a long period of time, actually should be pretty tolerable to do as you build yourself back up, get back to pretty much your exercise baseline. Some really important considerations: patients who have been on steroids for a long time, right? Please, please, please talk to your doctors. Right? This has important implications for bone health. We want to make sure we're not putting anyone at risk of a fracture. Right? Now, exercise is actually the way we help offset that, right? But again, this needs to be supervised, and this needs to be done in a sort of thoughtful way to increase the strength of the bone slowly. So if you go out and run a 10K and, unfortunately your, hip bone isn't as strong as it used to be from being on steroids for months and months, we have unfortunately seen bad things happen. So this is a really important conversation with your doctor. Same with muscular strength. So we know that particularly what we call the proximal muscles, so sort of your core muscles, things like in the hips and in the pelvis, are often affected by steroids. So the longer you are on steroids, the weaker those muscles can become. Again, we don't want to put anybody at risk. These are really good conversations to have with your doctor and then a physical therapist.
Thanks. One final question. In Massachusetts, anybody with a diagnosis of cancer in the last 5 years can get a free membership to the Y for themselves and for their whole family, which is an incredible program. And then there's also the Live Strong program. There's all these sort of exercise programs that are available for patients with cancer. Do you work with any of them? Do you recommend any of them? What do you know about them? How can you help us understand which ones are the good ones?
Yeah, so the answer is I have worked with many of them over the years. Unfortunately, I don't have as much sort of direct contact with them one-on-one anymore, particularly some of the closer ones here. I know some of the ones in New York a little bit better now. This is actually the entire point of that registry, so that we have a centralized database of a lot of us who actually know about this field and think about this field, to be able to communicate and talk about best recommendations, what is safe, how to really bring this safely to patients, and have some sort of centralized both repository and quality control. And so there are some great programs out there. The Y program is absolutely excellent. Livestrong has launched some really excellent programs. But I tend to direct people really right to that sort of growing registry, because we have more of a central sort of communication about quality control.
When you say, oh, the Y program is great, what makes it great?
So a few things. I mean, by far, the most important message I would like any of you to get is whatever it is, just do it, right? So if it's go to the Y because you enjoy it and you like the instructor and you like the group and it's free, please go to the Y, right? If you like to walk outside and then it's not so nice here in the winter, fine, walk outside and then walk on a treadmill, right? If it's SoulCycle, it doesn't matter. Consistency and actually doing it is what matters. So why do I say those are great programs? One, because there are actually a lot of cancer survivors, right? So people who have probably been in your shoes, right? And can help navigate some of these waters, whether it's the instructor and or another member of the group, right? May have had a similar surgery or a liver ablation or something else, and may be able to help kind of walk you through what their recovery looked like, how long it took them to feel normal after a month of steroids, things like that. But also because these group-based programs really do help build camaraderie and build consistency, and we know that. And so the only type of exercise that works is the one that you actually do.
Fantastic. That was amazing. Thank you so much, Allison.